This eHIV Review Patient Voices program is presented by DKB Med Radio. HIV and substance use disorders. Substance use disorder can take many forms. Nicotine, alcohol, prescription drugs, cocaine, methamphetamine, opioids. Regardless of the substance, untreated use harms most, if not all, individuals and is especially dangerous for people living with HIV. Our host is Justin Alves, a nurse and nurse educator at Boston Medical Center and one of our eHIV Review program directors. In today's program, we hear from Christopher McNally about his journey battling substance use disorder as well as HIV. This is his story. And now, Patient Voices.
I just want to welcome everybody to this Patient Voices session, which is the companion piece about HIV and substance use disorder. My name is Justin Alves. I am one of the program directors for eHIV Review, and I am excited today to be here with Christopher McNally to talk us through his experiences with both HIV and substance use disorder. So, hi, Chris. Thanks for being here today.
Hi.
I'm hoping that you could share a little bit with us about how HIV and substance use disorder sort of presented for you in your life. How did that come to be?
Substance abuse, started for me at like a young age, but the two sort of coincided when I was in my early 20s living in New York City. I was using pretty hard in my early 20s, and then I found I got my diagnosis of HIV, and it catapulted my using.
So you were using substances in your early 20s. You got an HIV diagnosis, and it really progressed the substance use disorder, would you say?
Yeah.
What did that progression look like for you? Was anyone able to intervene or help at that point?
I was hiding my substance use disorder pretty well because I was, that person who was just like the fun guy, the person who was just, joking about oh, how I drink too much already, or I like use cocaine. It's funny and stuff like that. And so then when I got my HIV diagnosis, I didn't tell anyone, and I kept it to myself, and it slowly started to it immediately blew up my entire life. I was in shock, and I didn't know how to tell anyone, and it sort of became this huge dark cloud over me. And I just started using really hard because I thought my life was over. And at the time it was over. I didn't want to tell anyone. It was this big stain on my life. And I started to use really hard. And so at first I didn't tell anyone, and I was in shock. And so I went on this really long bender of using alone and in secret. And at the time I had this job, and it sort of allowed me to use the way that I wanted and sort of still function. And then at that point I had to take a leave of absence and all this stuff. So it just started to slowly become this guy who was really fun and outgoing with my substance use disorder, and sort of plummet into this dark abyss where I didn't know how to function. I didn't know who I was anymore, and sort of that diagnosis sort of took over my life, and it became the only thing I was at the time.
Yeah. And so I know that this is obviously that's not where you're at today. And I'm wondering if you want to talk about some of the early treatment that you got and whether or not it worked or didn't work or how well it worked.
Yeah. So at the time, when I was sitting in the doctor's office, when I first got diagnosed, the doctor's talking to me, and it's all going in one ear and out the other ear. And so then all of a sudden he's like, "You're going to be put on this pill." I had no idea what it was. I didn't really listen. I had no idea what I was about to be taking. And so he said it was this one pill. I think it was a triplet at the time. And I, I just like, I would pick it up at the pharmacy. I didn't even know the importance. I knew nothing really about HIV at the time. Like, I didn't know, I just knew it was bad. I knew like people shamed it. It was bad. Like, it was like really bad at the end of the world. And so like when I picked up this pill, I didn't even want people to see me at the pharmacy picking it up. Like, it was this thing. And so when I took it, it was just like I didn't even want to be taking it. Like, I sometimes I wouldn't even take it. I didn't even like know like the importance of like how I should be taking it every single day. You know what I mean? It was like this pill, excuse my language. It was like um I don't want to be taking this pill. Why am I taking it every day? Like, who cares type of thing. Like, I don't care about my diagnosis right now. I hate it. So like, why am I taking this pill? There's so much shame.
Mhm. And so that's a little bit about like the HIV treatment piece. What did the addiction treatment piece look like for you?
There was no treatment at the time. Like, you know, I at the time I was like fully functioning, like working, um, and maintaining a life. But to that point, I did take a leave of absence for work for like, you know, a good month and a half. I had told my big boss that I had been diagnosed with HIV. He was the only person because they knew that something happened and because my work started to plummet. And so I didn't really tell them about like my substance use disorder, but like my work started plummeting. I was not the same and something happened. I knew I was going to get fired if I didn't explain something. So I told one person that was like my big boss. So I kind of like that was the only sort of like treatment or like something that happened to like help my substance use disorder and this diagnosis where I got to take a leave of absence. And in that time, I found the rooms of AA. And so I was going to meetings off and on. And like I hung out with like someone who was sober for a little bit. And like he became like a sober friend or whatever who I'd hang out with. But I would like still go use and then come back to like the AA rooms and still go use. And so that was the only type of at the time treatment, but it wasn't like any type of like, you know, it, substantial treatment. It didn't take me away from using. It didn't like, there was no like substantial time away from using. It was just like a thought. Like I needed to do something. I didn't know how to do something. Someone had introduced me to AA, but it wasn't like going away for treatment.
Yeah. And I know you sort of mentioned some of the substances you used, but I imagine which substances you used affected what kind of treatment was available to you.
At the time in New York City, I was drinking and I found cocaine at 17. So like I was drinking alcohol and using cocaine from like 17 up until like 28 or yeah, around 28 when I first went into treatment.
And then how did you finally find treatment programs that fit for you?
From the time I got diagnosed till around 28 years old, I didn't tell anyone about my diagnosis. I didn't talk about it. I didn't talk about my addiction. I didn't do anything about any of the problems in my life. And then all of a sudden, like this explosion happened and like my life completely blew up. And so then around like 28, like 27, 28, I fell off like a proverbial cliff and like I ended up just going to a detox. Like I had heard of people going to detoxes before and I didn't know anything about it. I didn't know what it entailed or anything. And so I ended up, um, someone had mentioned this place down the Cape called Gosnold. And I ended up just going in to Gosnold for alcohol. And I I like just left, my apartment, and I went, and that was that. Like I knew nothing about it, and I went and I did the like 14 days or whatever of detox, and then I went into their CSS program.
Okay. So what happened after that? What did treatment continue to look like for you?
So then after that, it was like, so that first time in treatment, they're like, if you go back to Boston, you'll die, blah, 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 blah. And so I stayed down there. I left Boston, for good. And I stayed down the Cape and went into like my first sober house. And then from that point on, it was like sober house. And then I would um, mess up and I would use. And then it would be like I'd cycle through detox and then treatment. And then I'd get out and go to a sober house. And then I would use and cycle through detox and treatment. And then I would use. And then there was one point where like I put a little bit of time together, and it was only because I had gotten in trouble. And so like I had like that, like, um, I had probation looming over me. So it was like I had to stay sober. So I put like a little bit of time together, but otherwise it was just like that cycle. And then there was a point when I was still down the Cape, and I had found a harder drug. I found crystal meth down there, and that changed absolutely everything. And like I had never really been like homeless. I kind of was always homeless. I was always staying in sober houses, but I had never really truly been like homeless to the point where like I lost absolutely everything. Like I was living like pretty much on and off the streets and everything like that, and cycling through treatment centers. And so this was like I couldn't even put more than like 14 days together or like 30 days together or whatever. So it just became more of like a cycle, and then like uglier and uglier um, lengths of using time. And so, yeah, that changed everything for me. And then treatment became a whole different type of thing.
How so?
In the past, like treatment, I could retain information. I could, have that drive to like get out and want to do better. And mentally, I had the capacity to get out and do better. With meth, it was like I would go into treatment and like get there, and like again, like none of the information I was processing. And then when I would get out, I just like couldn't function in real life. I couldn't function in society. It was just this like I would I would either fall apart or like something would snap, and all of a sudden I would find myself back in these horrible positions where like I just didn't even want to be there, but like my brain and my body were doing two different things, and like mentally I was just so messed up.
And I will just say from a treatment provider perspective, right? Like there's very little formal methamphetamine treatment available, right?
Yeah. When I first went into treatment, they put me on a ton of pills for like everything under the sun. Like I was bipolar, I was this, I was that, I was this, I was that, I was this, I was that. So they put me on like 17 different pills. And then I was still taking my HIV medicine. And so then every time I would go into treatment, they would switch up like four pills on me, or they would switch up like two pills on me. And like it's still this like box of 17 medications. And so every time I went into treatment, they would switch something up. And so I was so messed up. And so then when I went in for meth, it was the same thing. They would still be treating like the stuff they were treating in the past. Like this, they would switch up like 4 or 5 pills on me, 4 or 5 pills. And it was like the same stuff they had been treating for just the alcoholism. And so when I went in, it was a nightmare.
And so, what was it like when you finally found someone who could treat your HIV and your stimulant use disorder at the same time?
Something clicked, like it was no longer like these two different like poles that were on the opposite ends and that like were being treated separately and that I internally were like having to like hide and also that were causing me mental disturbances. But like now they were sort of one that I could like treat at the same time and also like start working on them, not only together, but like mentally together, if that makes sense. Like I could like start thinking about like processing them while they were being treated at the same time.
And I know a little bit about you. Um, how did some of the changes in your medicines from pills to injections change for you? How did that change outcomes for you, really?
I mean, honestly, that was a big change for me because one, like I was so sick, honestly, taking all those pills. Like I was just not a human. Like I was taking so many pills and like that, like they were just making me more sick, honestly. So to cut down on half of those pills was just in my mind like a huge thing. Like I felt like I was accomplishing like something more than like just like deluding myself more. So that was one big thing. Another thing was like a lot of like the shame and guilt around like my HIV treatment was like having to take that pill every single day. It was like a reminder of like this huge thing that like I hated even having to look at every day. And that was like taking that pill every single night. For some reason, it was just like a reminder and all that like bad stigma around it. And it just caused me like a lot of like anxiety and a lot of mental, it just messed with me. And so like when I first started to get the Cabenuva shot, um, that like lifted me up. That like lightened a lot of stuff around my HIV diagnosis. Like I was able to be more open about it for some reason. Like I had just started to be able to talk about my HIV. Like I had a therapist now, and at that point I had just started seeing a therapist. I had just started to be more comfortable talking about it, and then I started getting the Cabenuva shot, and it made me like even more okay with my HIV diagnosis. It made me more open to like being able to talk about it and being able to like process it better. And then with the other stuff, with like the my like substance use disorder, like having people actually understand that like all of these pills aren't gonna like fix this problem, but like targeting the issue and targeting it with like less medication, but medication that's actually going to like help their issue right now was huge. And like it actually started to work right away and not like all these pills that are like just covering an issue here and then covering an issue here and then covering an issue here, but maybe they're going to work and taking like a shot that's like going to affect the issue right now and do something right away was huge because I was suffering right now. You know what I mean? So yeah.
Yeah, I mean, I think your story is powerful in that, people who treat HIV should be able to do the addiction piece, and people who do addiction should be able to treat HIV, right? Because I think as you sort of illuminate, like they go hand in hand.
Yeah.
So, Chris, I'm wondering if you can tell us just like a little bit about like where you're at now today with everything. So, how are you doing in treatment today?
So today I am almost 10 months clean and sober. This is the longest time I've ever had um, clean. And um, so, I mean, honestly, I'm doing pretty well. Like, I'm finally in a good place. And I'm finally like working on the issues, and I'm able to work on them because I'm finally like on the right medications and like able to work on them.
I think you're doing pretty well too. Thanks for being here today. Thanks so much for talking with me. I know we talked about a lot and we got pretty deep, so I appreciate that. And I appreciate you being here.
Thanks for having me.
For eHIV Review Patient Voices, I'm Justin Alves.